further debate, the member from Nepean.
Thank you, Speaker. Congratulations to my colleague on her first private member's motion, an important one at that. Warms my heart seeing more healthcare workers here at the Legislature. I rise today not only as a member of Provincial Parliament for Nepean, but as a registered nurse, someone who spent years at the bedside seeing the real-life consequences of a broken system. And let me tell you what it looks like. I remember a patient I cared for managing diabetes, working 2 full-time jobs with no health benefits. He was rationing insulin, not because he didn't know better, but because he had to choose between bills and his prescription. He ended up in the hospital with diabetic ketoacidosis, something entirely preventable, something that costs the system far more than a steady supply of medication ever would have. And this is not an isolated case. This is a story playing out in emergency rooms, urgent care clinics, and community health centres across Ontario every single day. 1 in 5 Ontarians either lacks prescription drug coverage or doesn't have enough. That's not just a healthcare gap, it's a crisis, and we can't keep pretending it isn't. That's why I'm proud to support this motion, because universal access to prescription medications is a fundamental piece of a modern healthcare system. You can't say you believe in universal healthcare while leaving people to fend for themselves at the pharmacy counter. Prescription drugs are not optional. They are as essential as a hospital bed, a diagnostic test, or a surgery. And when people can't afford them, they don't take them. When they don't take them, they get sick. And when they get sick, they end up in the hospital, putting more pressure on an already strained system and costing us all more in the long run. The goal here isn't just to treat illness, it's to prevent it, to keep people healthy, at home, with their loved ones, and not in a hospital bed, dealing with complications that never should have happened. As a nurse, I've always believed in upstream care. You solve problems before they escalate. You intervene early, and that's exactly what this motion aims to do. But, Speaker, let's be honest about how we got here. In 2018, the Ontario Liberal government introduced a plan to eliminate deductibles and co-pays for Ontarians and seniors under the Ontario Drug Benefit. It would have made medications more affordable for hundreds of thousands of Ontarians. It was going in the right direction. But this government cancelled that expansion before it could take effect. Since then, drug costs have not only gone up, and more people are being forced to make the impossible choices. And while provinces like BC, Manitoba, and PEI have moved forward with the federal government partnership, Ontario has opted to sit on the sidelines. No plan, no urgency, just more people falling through the cracks. And who are those people? They're often the working poor, folks in precarious jobs, gig workers, small business owners, and people who don't qualify for existing benefits and don't have private insurance. They're not asking for handouts, they're asking for fairness, for a system that works. I support this motion and moving towards actual universal access, and we support doing it the right way, with a clear strategy that ensures the system is integrated, sustainable, and equitable. We know the cost, but we also know the cost of inaction, and that's what we are living with now, the human cost of a government unwilling to lead. So, Speaker, I support this motion because I've seen what happens when we don't act. I've cared for the patients who couldn't afford to get better, and I believe deeply that no one in Ontario should suffer or die simply because they couldn't pay for medications they need. Let's stop sending people to hospitals for conditions we could have prevented, and let's start building a healthcare system that includes access to medications as a basic part of healthcare and not a privilege. Thank you.
Thank you. Further debate?